Hello, ouch, my epilepsy warriors. Um, I told you I was going to make a video about the SEEG surgery that I was having. I had it about exactly 4 days ago to the hour. If you're a little unfamiliar with what an SEEG surgery is, it it's a really long word actually, but it's basically where they drill little tiny holes in your skull, and then they take these things that kind of look like uncooked spaghetti, and those are called leads, and they stick them very carefully into different parts of your brain that they believe the seizures could be coming from. The surgery was done at Cleveland Clinic, so it was done robotically, which is great because it improves the accuracy of the results, the delivery of the lead, and it cuts down on the time that the patient gets to be put out under general anesthesia. So, again, it was 2 to 3 hours. They did shave my head, so like basically from the center over, I have hair, but there's nothing dangling down here because that's all gone. And the surgeons were very respectful. They wanted to make sure I was comfortable with what we were going to do with my hair, but at the same time, like, leaving it can lead to infection and it can just be in the way, and I just wanted to make sure that I had the best surgical outcome and something like vanity wasn't going to be in the way. So that's going to grow back. But I have just, after the SEEG surgery, which thankfully I was a candidate for, they brought me back to recovery for about a day. I had a little bit of bleeding. That's not normal. It doesn't mean they did a bad job. Everyone's body, everyone's brains react a little bit differently, and that just happened to be, I happen to be in, I think it's like 1%. I might be quoting that incorrectly, but I know it's a very small chance that something like that can happen. So they just watched me to make sure that my brain calmed down and everything was fine, which it did. And once it did, they brought me back to the lovely room I have here. I don't know if you can see it because of all the sunshine, but I'll just come back to me. So they brought me back to the epilepsy monitoring unit, and they are just basically waiting for seizures. My glasses are so crooked right now. I know. I can't see. I have them taped to my helmet that I have yet to address because I need them to see, just not to make more headaches or anything, so please forgive my appearance. I feel like the little, what did I named myself? If anyone has ever played Super Mario, there's a little character, the mushroom guy. Someone just told me his name was Toad. I feel like Toad right now. A girl Toad. So anyway, yeah, today, 4 days out, I'm doing much better. The pain management has gotten into a groove, so obviously I probably don't look very uncomfortable for you, aside from the fact that 20 holes were drilled in my head 4 days ago and have leads sticking out of them. It's pretty amazing what they can do. So, just hanging out. I have not had a seizure yet. I am a little bit disappointed with myself. Usually because of the amount of seizures I had, I just thought it would happen super quickly, but it didn't. So, I'm just hanging out. They're going to take me off all of my medication, I think either today or tomorrow, so we can get the data, that we did the surgery to collect the data, so I need to give them the seizures so they can figure out where those seizures are coming from. And more importantly, they can figure out, like, they can just make sure that they're not removing any, like, quote-unquote eloquent type of areas, just in case the hot spot or the seizure focus were to sit in an area that could make me, you know, not see again, or I wouldn't be able to use my arms anymore. So just some sort of like very high function or eloquent, as I understand it to be, area. That's also a significant benefit of this SEEG test. So yeah, after the surgery, they just wrapped up all the leads. I've never seen my head. I don't really care to see it. I'm good. They just put this fancy helmet on me, and it's not so bad. I honestly think a traditional EEG is so much worse. As far as comfort, I hate all the glue in your hair, and then every day they come in to the hospital and just glue more stuff on you and just tinker around with it. This one, they just leave you alone. You know, it hurts, but you learn to deal with it, and the staff doesn't want you to be uncomfortable, so it's a good combination. They take care of you. But hopefully, you know, I'm thinking over the next few days, without being on any medication, I will be able to give them enough seizures so they can collect the data they need. At that time, there would be a second surgery. It's a pretty short surgery. I don't even think it's longer than a half an hour. There's the measuring and super like farming and mapping that they needed to do to my brain to put them in the first place is why the surgery took so long the first time around. The second one, they're just putting me under and just pulling all of the leads out. And then each hole is so small that it actually only takes one stitch to close. So things are going to look a little crazy, but I'm not going to have like gaping holes all over my head. And as you can imagine, one stitch is a pretty small wound. You know, I will need time out of work if this is my only procedure that I do here. You know, the doctor said you could need like 6 weeks out of work, because for me specifically, my brain damage is deep. That's what they're looking at to find my seizure focus. So each of the leads that I was calling uncooked spaghetti, it goes, you know, obviously through your skull and about halfway through your brain. So that's why you need the time off, is to heal from that and, you know, just rest, make sure you're not going to have any infection, anything like that. And obviously, you know, going back to work and moving around, getting ready, just being back to you has got to wait. You got to heal first. So yeah, I just wanted to kind of give you guys an update in case this is something that you or someone you know is going to be going through. You know, it's a little rough. Hey, it's brain surgery. It's not an easy feat, but you will make it. You will make it. I had a tiny complication, and we sailed right through. And, you know, like I said, I haven't had a seizure yet, but I've been able to recover these like 3.5, 4 days, just heal from everything, which is probably what God needed me to do anyway. So it's probably a really good thing. But anyway, yeah, I'm here just hanging out. Pray for me to have a seizure if you find the video. That's what we need to give the doctors, so they can give me some good news. And, you know, at that point, like once they evaluated everything, they'll go back to conference and, you know, meet with all of the different specialists in the departments and determine whether or not I'm a candidate for a type of epilepsy surgery. There's a bunch of different types of epilepsy surgeries. They may be leaning more towards a resection for me. It may be a temporal lobe resection, but I can't predict the future, and that's nothing they have promised at this point. It's just, a thought or a theory at this point in time. But, feel free to ask questions if there's something you're curious about, or, comment on the video. I'm happy to help you, since this is something that I've been through. And if you need help or you just want some support, I'm happy to offer it to you. Okay? You guys take care.